Welcome to my weekly show, How to Care for a Loved One with Dementia. Each week I share a practical tip for family caregivers. My name is Roseanne Burke and I'm a certified dementia consultant. Today is March 20th, 2020, and what a week it's been as we all try to cope and live through this pandemic of COVID-19 affecting everyone around the world. And if you're caring for a person with dementia, then you are facing extra challenges these days, one of which is the fact that for many of you it means you can no longer visit a loved one in a nursing home. And I know that can be really stressful and worrisome to folks. So today I wrote an article in which I share 19 ideas or tips to help you cope during this time. And if you want the entire article, please comment below. I'd be happy to send it to you. In today's video, I'll share just a few of the ideas that I had come up with. So the first tip I want to give is to please remember to say thank you and show your appreciation to the hardworking staff that are taking care of your loved one. They're working overtime and in some cases working double shifts to make sure that everyone is kept healthy and safe. So please show your appreciation. Secondly, a lot of people are trying video chats, which seems to be the most obvious solution in the absence of personal visits. So I know some nursing homes have purchased extra tablets for the purposes of helping families connect with residents over Skype or FaceTime. And so just check in with your nursing home and see if that's the case, or see if you can drop off a tablet of your own. And if your loved one needs help, if they'd be willing to help facilitate that connection between the two of you. And I'm sure they will be willing to do that. So there's that. Of course, after tablets, and if that seems a little too techy, then there's old-fashioned phone calls, which, depending on where your loved one is at in their journey of dementia, that may or may not work. But if it does work and they're able to use the phone, then a phone call a day can be a really effective way to connect. And old-fashioned letters are always nice to receive. And the great thing, of course, is that they can be enjoyed over and over as a reminder of your presence and love. If you have an idea of something that you think would help ease the loneliness or concerns of your loved one, if they're wondering why you're not there, or if you're concerned that there's something you always did for them or with them that is no longer happening, then maybe share and prioritize one activity that you'd like to ask the staff to help you fulfill. And so something like that might mean that you'd like to send a daily email to your loved one, and you're asking that they print that off and share it with them and maybe read it with them if they need help with that. Or maybe it's you're asking them to sing a favorite song with your loved one every day that you know can really cheer them up or boost their spirits. Or maybe it's to recite a prayer that can really bring them peace and calm in these turbulent times. So whatever it is, don't make a big laundry list of demands. Obviously, they're not going to have time. But if there's just one thing that you think is going to make a difference to your loved one's day, I think they'd be open to hearing about that. Another thing that we're seeing online a lot is people making window visits to people, I guess, when they're on a ground level floor of a facility, and trying to, communicate or at least show their presence through the window to their loved one. In many cases, this seems to be working and going well for families. I will caution, however, that you should proceed with caution on this because it can backfire. There is the risk that your loved one will just become more confused or anxious about why you're on the other side of the window, why you're not coming in, or why they can't go out. And it may increase their desire to want to go outside. So just think it through, and again, ask for the help of staff in trying this if you think it's something that could work well for you. Okay. Another tip is that if there is a particular phrase or response that you always use to questions that your loved one might have, so it might be something like, I want to go home, or where is so and so, and maybe so and so is deceased, or I need to go to the bus stop to pick up the children, they're going to be waiting for me. Those types of scenarios are common with people with dementia. And so if you have something that has been working well, that eases their anxieties around some of those issues, then again, I think sharing those with staff and letting them know, hey, if you say that mom is at the grocery store and she'll be home soon, or dad is at work, he knows you're safe and sound and he's not expecting to see you for the next couple of hours. I think that can be helpful information in terms of providing person-centered care that the staff would be open to knowing about. Another tip is, while you're at home, use the time to create a personalized playlist or a life story book or a photo album, something that will benefit your loved one when you are allowed to go in again. And it will keep you busy and occupied at home as well during the time that you're not able to go visit. And last but not least, certainly not least, is to please practice some immaculate self-care during these difficult times. Use this forced time apart as time to take care of yourself and to practice some excellent self-care, whatever that looks like for you. Okay, so deep breath. We will get through this. And again, if you want the article, please comment. And if you have any other questions you'd like me to answer, I'm happy to do so. So drop those in the comments as well. If you're watching on Facebook, please like my page, Kedgy Consulting, or if you're on YouTube, please hit subscribe. Thank you very much. Stay well, stay calm, take lots of deep breaths, and remember that this will end, hopefully soon. Okay, take care. Bye.